months, I've had situations where patients have come in before surgery and haven't lost weight as part of their preoperative requirement. And, you know, we sit down and go through things, and more often than not, I've had the feedback that, well, I now know it's happening, I'm going to do it. And this is like 2 weeks before surgery. And we had this meeting like 3 months prior or 2 months prior, and we had all the discussions about how to make yourself more optimal. And it's got to the 2-week crunch, and now the person is going to make an initiative. So that really is not helpful. I mean, the idea is you're going to be on a lifelong journey. You have to make those adjustments and changes. And the sooner you make those, the more competent you become, because you're much more comfortable with it, you're more confident when it gets to the time. And if you don't, it's more of a struggle. I think somehow a lot of patients seem to think after surgery, everything else in their life is going to be perfect. The bank account will be richer, maybe, or the husband or the spouse will be kinder, or the job satisfaction will be greater. And quite honestly, unfortunately, none of those things probably are going to necessarily happen. You know, the stress of finances are going to be the same. Job and family issues are going to remain the same. But what does change is you. You're going to become more comfortable because you're healthier, you're more confident, and you probably can handle those punches better. But the punches are going to keep coming. And so some of the patients I've noticed tend to have a hard time coming into terms with that. And you really got to think this through. Your life as a whole is not one thing, it's a multitude of factors, and it's going to keep changing, and you got to be ready. And if you take this initiative, you've got to think it through. Am I going to be able to pay attention to my needs? Am I going to continue to eat healthy, exercise? Am I going to be able to support my needs financially? And you know, we certainly do as much as we can in trying to support a patient, but the success ultimately depends on that person recognizing that they are the patient and they're in the driving seat. For every down, you're going to have an up, and you know, it's not going to be always perfect. You're going to have misfires, and you're going to have difficult times, but you just got to stay committed and stay focused. So really, I think the message I would give you is just to never forget that, and if you have little humps, always go back to your baseline. Remember what you need to do. Analyze yourself, see, don't become overcritical, but have an open mind about it, and don't be offended if friends or family come and make certain comments to you. They don't have the same insight that you have to any of this, really. You know, you won't know it. Even me as your surgeon, I won't have the same insight as you as patients. I mean, we kind of get close, but we don't really know. You won't know the path until you drive it. I mean, how many times have you all sit in a car as a passenger and you've been driven somewhere, and then next time you try and go it yourself, you think, okay, did they turn left or right at this light? I can't remember. You've got to drive it, and then you'll remember what you did. So ultimately, it's all up to the person, and ask for help and support, but you got to carry the load. That's very true. And what we're finding is that, you know, still you have to match the right operation to the right patient. The sleeve traditionally was designed as a stepping operation for the super morbid obese, i.e. patients whose body mass index was greater than 50. And it was a staging operation where you kind of go in without having to worry about mobilizing and doing lots of cutting and rejoining, just downsizing the stomach and allowing that patient to lose a good percentage of their weight, so then the abdomen becomes more conducive to going back for the second, if you like, definitive procedure. And the results were so good that then we started implementing this operation and introducing it to patients who were lower body mass index and doing it as a definitive operation. So this is how it evolved. Now, through the last 10, 11 years, it certainly has developed itself and evolved to a level that we see with patients whose body mass index is in the 40 to 50 range. The outcomes are very close, especially if you choose your patients well, i.e. the ones who have lower comorbidities, lower end of that body mass index scale, typically a little bit more dynamic, younger patients that maybe, you know, are going to be able to do a lot of more exercise. They can get close to 80–90% of their excess weight. And the maintenance of that curve longitudinally is very similar to the bypass. You know, after 5–6 years, you reach somewhat, of course, this plateau, and you start to gain a little bit of weight. And that's the physiological response. First, as you get older, your metabolism slows down, and also, you know, your habit starts to change a little bit, and your eating plan changes a little bit. But yeah, it's a great operation. But you know, if a patient comes to the office, and I had a situation actually very recently, body mass index of like 70, diabetic, sleep apnea, high blood pressure, and cholesterol. So that kind of a situation, still the bypass will be the best match. But you know, it's a tool, and you have to feel confident in utilizing that tool. So it's no point me telling a patient, you can only have this operation if that person is not going to want it. I would certainly encourage them to think through it again. But if the choice is between no operation and an operation that is going to give them a good amount but not as good, then I would still go with that. So, but going to these meetings and choice decision makings, very open-minded, look at all the fine print. But yeah, it is a good operation for sure, but you got to use it right. You know, the pitfall, if you like, with the sleeve is you can start to eat everything, as in some patients with a bypass can. But if you don't take note of it and you become complacent, you can put the weight back on easier because you don't have dumping. And if you tend to tolerate carbohydrates and doughy foods, which sometimes patients with sleep don't, because it tends to get stuck. But if you tend to tolerate those things and you eat those things more and more, then yeah, you can gain weight. But so far, results have been very good. So, and if you get also cravings for certain things, this is after your initial month or two, that you feel, okay, I really like this, but I shouldn't eat it. My thoughts on this is it's worth to keep avoiding it, because eventually, if you give into it, it will be a very negative, like chocolate. Patients always ask about it, can I have a chocolate? I say, listen, of course you can have a bite. It's not a big deal. But they say, no, or coffee. That's another good example. No, I'm not going to have coffee. Coffee, if I have one, I have to have a gallon. I mean, you know, that's the kind of response. Well, you can't have a gallon, so you have a cup. Right? But that's the problem. You say, I resisted, and then one day you just give up, and you go and drive up to, I don't know, Starbucks or something, have a venti with double whipped cream or something. And that's much worse. Whereas if you have a cup, and you don't believe me, a lot of the times patients have saying, you know what, actually I don't know what the fuss was about, I'm done. I bite a chocolate, or I licked a bit of a tortilla or something. So much better that than kind of putting all these iron gates all around you and then explode. On the other hand, you may develop cravings for things you didn't like. So be ready for that too. It's like pregnancy. So you may say, why? Well, this is strange. I suddenly start liking fish. I never liked fish or something. It does happen. Which is, by the way, just so you know, as you get further away from surgery, it's not an unusual feature, right? Your weight loss curve slows down. And you just, like you said, need to go back and look at it and see if you're doing everything that you need to be doing or if you're falling short somewhere. So it's the same thing with your nutrition. If you are running short, low, or above, your fuel engine is not going to be operating optimally, and so you'll know it. So it's important to every now and then go back, do a little survey of what you're doing. Now, you don't have to do it every day. In fact, I really don't encourage it because I think you'll get paranoid and then you'll become miserable and you just won't do it anymore. Once a week, twice a week. Typically, everybody has very routine kind of days, 5 days at work, you know what kind of breakfast and lunch and dinner you're going to be having. So maybe you take one meal of the week and one weekend day, and you get a sense of what is the 12 to 1400 calories, and you implement that. And you make sure that you, again, I always kind of go over this with patients, that you've got to have your 3 meals as best as you can. Try and not miss your meals. And every meal ideally start with some protein-based foods, whether it's a fish or a chicken or a turkey. And if you don't have access to making food for yourself and you have to rely on the unhealthy options, you choose the best of the evils that is out there. And you've got to think this through with every meal. Your 1,200 calories, 50% of that should come from your proteins. The other 50% can be an even split between the carbs and the fats. So any situation that you're thrown in, you've got to try and apply as best as you can those kind of routines. And if you have the luxury of being at home and having time to make breakfast for yourself and lunch and dinner, and that's a lot healthier, then you make that option. But eat the protein component first, the vegetable component second, the carb component last. Take your time with things, space things out. Don't eat and drink at the same time. Take your protein shakes between your meals, really important. And in this hot weather, best to dilute proteins way down because proteins can cause kidney stones, can cause constipation. And in this heat, your insensible loss is huge. So you've got to get lots of fluids in. So dilute those proteins, put them in a thermos cup, add ice, add water, add non-fat milk, and sip on it over 2-3 hours. One between breakfast and lunch, one between lunch and dinner. That way you get 3 meals and you get 2 supplements in between. Now, the beauty of the slow consumption of these supplements is that it constantly challenges your stomach and your pouch. You're going to be kind of having lower cravings, hunger less, eating at the time of your meals is going to become smaller in capacity because you're not as hungry, your portion sizes will be smaller, you absorb the proteins better, you'll start to have a more fine-tuned metabolism and actually lose more weight. So again, this is something that I hope everybody, even 1 year out or 2 year out, always goes back every now and then, check, check, check. You know, last year ASMBS, which is the congress that we go to, the comments that were coming across was that patients and doctors get very fixated on a number as far as the weight goes. And we have now learned to stop doing that because the body is very complex. We have trends, we have things that we know, but everybody is different. And if you don't get to that 80th percentile or 70th percentile and got to the 65th percentile or the 55th percentile, that's still very significant. You're a lot healthier, you're a lot better, but I would only give you the comfort of knowing that as long as you understand and make sure that you've done everything right. If you've done half of it right and you're at that point and you give yourself a big pat on the back, it's not as legitimate. I would say the legitimate pat on the back comes when you've done everything and you've lost 65 and your body says, look, I'm happy I'm staying here. Because I know for those of you who may have been here when we had our nephrology colleague, Dr. Tuso from Kaiser, that he talked about is the body has a set point and it's going to swing to that set point. You push it one way, eventually it will come back to the set point. You push it the other way, it comes back. So that means your physiology is going to dictate where you'll land. As long as you make all the right moves, you can hopefully get to the numbers that we all expect. But if you don't, and you're feeling healthy and you're doing the right stuff, eating healthy, exercising, taking your supplements, you're good.
I would say, too, that people, you ask how are they able to do it, the people I've talked to who have alcohol, it goes right down and it's full of calories. Alcohol, snacking, whereas they, there's, that's why we talk about having life skills and coping mechanisms, because if food is a thing that you can turn to again once more, they'll find something to start snacking on again, and they'll start, and you can get those little bits down. If you don't have another way to cope with stress or something going on in your life, if you can get those little, snacks down, they'll snack. If they don't have the gastric bypass, or sometimes even if they do, they'll increase sweets. They'll just push it a little more, a little more, a little more until they can get that in. But snacking, and the people have talked also alcohol, because again, empty calories, or what they're eating. Like we even talked about, because you're in class, we talked about the yogurts. You can get that same amount of yogurt in, but you could pick the one that has 100 calories or the one that has 200 calories, and it's the same amount of yogurt. And if you're having 2 yogurts a day, that's 200 extra calories. So, it's just all those little choices when people aren't as careful.
Wow, good job. Congratulations. So if you do your 12 to 1400 calories, and let's say take the mean, 1300, and you do 20 minutes on a treadmill or on a bike, you're probably going to lose 200 or 300 calories, so your net is going to be 1,000. Right. That's a good place to be, because pre-op, getting to surgery, that's going to actually allow you to lose weight. Post-op, you're going to find that you will survive and do very optimally on that total net of 1,000. But you're not okay if you're taking 1,000 calories and you're having 300 calories burn off and your net is 700. Right? So you really have to be in that 12 to 1,400 calories. Now, for some of the patients who you may have seen in the previous support groups who do biking 70 miles and they burn insane amount of calories, clearly that person has to take 2,000 to 3,000 calories per day, and they do, because they're going to be burning 1,500 calories during that 70-mile bike ride. So your net amount of 1,000 to 1,200, you're in a good place. Net amount below 1,000, it will eventually make you feel unwell. So you want to maintain 12 to 1,400 calories, and then you exercise routinely. That 30 minutes or more probably is going to burn off 300 to 400 calories. You're not going to be, I mean, if you are intense, your body will tell you, because you'll start to feel more hungry.
I want to use her response to something you mentioned when you said, what's the difference going to be this time when I've tried it before, and how am I going to be able to stick with it this time? That, because whenever we tried diets before, you could lose weight. I remember doing Scarsdale diet where you could lose like 1 pound a day. Does anybody remember Scarsdale? You could only maintain that for like maybe 10 days or 2 before you'd make yourself crazy. On this, you're not making yourself crazy, and you're losing a dramatic amount of weight so quickly. It's unlike any other diet. It's unlike any other experience you've had before. So that does give you the motivation to say, this is incredible. I'm going to go exercise. I'm going to go make the most of this. This is amazing, because you've never had it. You've never had weight loss like this before. So it sort of helps you and motivates you with all those other things you need to do. You think, well, this is amazing. This is fantastic. I got to make this work. What do I need to be doing? And I'm not saying you don't have those off days, but you sort of start to track and take advantage of everything and do everything you should, because it's unlike any experience you've had before with weight loss. It sort of motivates you to do everything because you want it to keep going. So that's why it's different too.
You will still have some growling. You will have hunger pains. That's normal. It's not going to be as intense in most patients. And when you do get those, you don't ignore them. You will have something, and you need to. And that could be ideally something, again, that is protein-based, whether it's a shake or whether it is yogurt or a half of an egg or a beef jerky or a handful of almonds or even a slice of a fruit, that's it. There's only one way you're going to find this out, and eventually it will catch up with you. All I would tell you is, you know your boundaries, you've kind of studied them, you're aware, you're intelligent, you know what kind of things you should avoid, and I would tell you, as long as you stay within those guidelines, 99% you'll be fine. And don't make big jumps, introduce things slowly, like we talked about. In the morning you can introduce maybe half an egg, then lunchtime you can introduce maybe a slice of avocado with 1 turkey roll. Dinner time you can have maybe a half or a quarter of a can of tuna. But you've got to venture out now. So it's like, baby's starting to walk. You're going to have a fall, but you're going to be stronger for it, and you will learn, and you will mature, and you will be confident. And this takes 6 weeks, okay? It's not going to come overnight, so don't beat yourself up. But you got to kind of, gotta take the leap of faith. You're going to eat something maybe a little too dry or too big of a bite, or you kind of didn't think it through properly. So the worst thing is going to happen, whether it's the sleeve or the bypass. It's going to get down here, and then you suddenly remember, oh, okay, you got to sit maybe for a few minutes. You may have to take a sip of water to help pass it through. You may burp a few times. You may have to excuse yourself, go to the restroom, and you may vomit it. or it may just sit there and bug you for half an hour until it passes through. Okay, it's not going to burst anything. It's not going to guff for a bit, do anything crazy. So you got to say, okay, what is the worst thing? And really, you got to make progress. This is a train that is going that way. You got to go with it. And the nice thing about it is you're not alone in this. I mean, just this room alone tells you that so many have kind of done it, and above and beyond our program, there's thousands of other patients, and they've all been there and done it. So feel reassured by that, and just little by little.
2 patients who did This Is How I Do It, and where a male and a female patient, the male is a sleeve, the female is a gastric bypass, and exactly what you just said. They took a weekday, like a work day, and a weekend day, and they tracked what they ate, because sometimes people have difficulty. Well, so what do you eat in a 12 to 1400 calorie day? And they go through, so like you can see, even I think the male, I think his breakfast is at like IHOP, but he still tells you what he ate and how he stayed under, like, I think 1,400 calories or 1,450 or something for the day, how much protein he got in, and how they exist on weekdays and weekends, still getting that in, getting that protein in, and doing all that, and how much they use. So,
yeah.
But there's also menus and recipe ideas, but that's 2 successful patients and what they eat throughout the day.
And the exercise, that's really, really key. Most patients with weight have issues with their joints, but you can't just say, I can't do it. Really, that's not an option. I mean, I will tell you the low impact exercises that you can access are reclining bicycle, elliptical glider, a rowing machine, swimming, something that you have to find for yourself, that niche, and you got to stay with it. And consistently, those of our patients that come back for follow-up who have not done exercise, it's within the first minute you'll know, because the numbers do show that 10-15 pounds lag, and it is a 10-15% difference. And everybody immediately says, I do a lot of walking. That's I would say the most commonly given answer. And then, where do you walk? Well, I go to my mailbox, or I kind of do my vegetable garden and I walk. So I mean, these are good, they're not bad, but you gotta do cardio. It's significant that you do cardio. 45 minutes of either biking, treadmilling, elliptical glider, or something that gets your heart rate up, gets your blood pressure going. And if you don't, you're not gonna see that additional 10-15%. And the exercise role is even more important after a year, because it's what maintains your weight at the baseline that you've reached. If you don't, that plateau goes up. So in order to keep that plateau at where it is and prevent it from swinging up, is to keep that exercise going. Congratulations, well done. So happy for you. Thank you for sharing that, that's awesome. For those of you who haven't had it, do great, and maybe in 3 months or so we'll be sitting telling the other group how things went or your experiences. And for those of you who've had it, just really keep up the good work.